This is PAILs and RAILs for hip internal rotation. So in other words, it's your ability to do this action or this action. And I know that looks like I did two different movements, but when we're talking about hip internal rotation, we're referring to the movement of our femur in relation to our pelvis. So if you're someone who's having lower back pain, knee pain, you have an inability to get depth in your squat, chances are you might be limited in your hip internal rotation, in which case you should train it. We're gonna train this from a 90-90 position, focusing on our trail leg in the back here. Because we're not training the front leg right now, you don't have to make your 90-90 super strict. In fact, you can actually just pull that heel in to allow yourself to sit more comfortably in this position. Step one, you're gonna actually rotate your torso towards that trail leg and try to rotate as much as you can until you can start to feel a stretch happening on this outer hip here. And you're just gonna hang out here for 90 seconds to 2 minutes. Breathe into the stretch as much as you can. And with each exhale, see if you can get a little bit deeper into the stretch, allowing the tissues to adapt to this position. Now, feel free to lean back a little bit if you're having trouble maintaining this 90-degree angle here. From here, what we want to do is we want to start to rotate our femur or our thigh bone outwardly, and simultaneously we want to drive this foot down into the ground, being mindful not to let this knee pop up off the floor. And we're going to ramp this intensity in 20% intervals. So you're going to start by 20% effort, make this foot heavy into the ground. Then you're going to ramp up to 40%, then 60, then 80, and then 100% effort, squeezing everything. So squeeze your glutes, drive into the ground as hard as you can. And you're going to hold that for 10 to 15 seconds. As hard as you can, don't lose it. Afterwards, what you're gonna do is you're gonna let go of that intensity, ramping down slowly. So don't just let the tension go. Right when you get back down to zero, you're gonna go right into your rails contraction. And now the intention is we're trying to rotate the femur. We should feel all of this stuff on the top right here in this tissue here, the TFL. All of this starts to contract. We're still leaning this way, but now we're trying to lift the foot off the ground. Because we're in our end range, you're not gonna get much movement here, but that's okay, that's the point. So we go into our rails contraction, making this knee heavy. We're rotating the femur and trying to lift that ankle off the floor. You should feel all of this tissue on the top here contract, and you're fighting and lifting as hard as you can. Don't lose that tension. Lift, keep lifting, trying to make that foot nice and light. And you're holding that for 10 to 15 seconds. And then you're gonna slowly let go of that tension and try to see if you can sink down a little bit deeper into a new range of motion. And then take a couple of deep breaths in here to establish your new range. After that, you can repeat for 2 to 3 more rounds. If during the PAILs contraction, meaning you're driving the foot into the ground, if you notice any kind of medial tension or pain in the side of the knee here, then what you can do is you can actually start to plantar flex or point the toe to reduce some of that pressure off of the knee. For your rails contraction, you want to make sure that you keep your torso still rotated as you're lifting, and trying not to lean forward, because as I lean forward, notice that I can actually lift my heel or my foot off the ground a lot easier. And if that's the case, then it means that I'm not in my true end range of motion. So I want to make sure that I've established my full end range of position, so that way when I try to lift off the ground, I'm training in that end range as opposed to training in a range that I already own.